Well, hello, everyone. Apologies for the late start. I can get a little chuckle out of this. I hope you can too. When we're talking about technology today in our Health Hour Live, I had a little bit of a technology fail here in the office, so I'm joining you on my phone. But nevertheless, we'll get underway. So hello and welcome to Health Hour Live. My name is Leslie McGill. I'm the CEO of MedicAlert and your host for what I know is going to be a very interesting discussion today. Before I introduce my guests, I want to take a couple of minutes to share with you what's been happening at MedicAlert over the past year. Yes, we took a little bit of a hiatus from Health Hour Live in 2022. And that's because we had a very, very busy year last year as we prepared for our own digital transformation. And when I say transformation, that's exactly what it was. Our technology systems, although absolutely safe and secure, I want to reassure you that, but our systems were 20 years old, well past their end of life, and certainly not current in terms of today's technology. So what I want to do is thank our donors, because it was with the wonderful support of thousands of donors that we have been able to upgrade our entire technology backbone. And many of you who are subscribers know that we did that about a month ago. And yeah, there are a few little kinks we're still working out. But when we transform an entire system, those are bound to happen. So we're thrilled that we do have a very, very modern technology stack that we are currently working with. So I want to again say thank you very much to our donors. Many of you are on our call today. We couldn't have done this without you. And that's a really great segue to talk about something else that happened about a month ago that is absolutely central to our conversation today. In February, we launched our Safe and Found program with a kickoff fundraising campaign goal of $500,000. And we're well on our way to reaching that target, but there's still lots more opportunity for our donors and maybe those who might be considering a gift to MedicAlert to help us to reach that target. So what is it that we're exactly raising funds for? Well, that's some of what we're here to talk about today. So technology and the impact of wandering when it comes to living with dementia and care partners and the people who surround individuals living with dementia, technology is becoming much more important in the support for people who wander. So today I am extremely delighted to introduce three very important partners, MedicAlert partners, who have been working diligently with us behind the scenes for the last year and sometimes almost 2 years long to help us to prepare to launch Safe and Found. We know that this program is going to be a significant game changer for people living with dementia and their care partners, no doubt at all. Because we know you as care partners spend much time worrying about your loved ones, whether they will wander, if they, and what will happen to them fundamentally if they do. So today, I'm pleased to introduce a panel of three wonderful people who I've had the joy of working with over the course of the last couple of years. First, Dr. Lili Liu, Dean of the Faculty of Health at the University of Waterloo. And Dr. Liu, for those who don't know, has dedicated much of her academic career and scientific career to understanding the dynamics of people living with dementia and how best to support older adults and their families through the use of technological advancement. So welcome, Lili. We're really thrilled to have you here today.
Thank you, Leslie.
Also with me today is Karin Marquez, Chief Public Safety and Brand Officer for Rapid SOS. And Rapid SOS is what you might call a technology disruptor in the public safety space. And for those of you who don't know much about the public safety space, and I've certainly learned a lot about it in the last couple of years, we have been working with Karin and the team at Rapid SOS on a special project. You're going to hear a little bit more about that today in the Ottawa area, and that is scheduled to launch in the next couple of months. So for any Ottawans on the call, stay tuned. There's lots more to come on that front. And Karin, welcome today. We're really glad to have you here.
Happy to be here. Thanks for having me.
Great. And last but certainly not least is MedicAlert's newest partner. Welcome to Don Williams, CEO and founder of CounterCrisis Tech, another Ottawa-based company. So very thrilled that Ottawa's getting well represented here today on this call. And Don and the team at CounterCrisis Tech have been working directly with the federal government to revolutionize ground search and rescue across Canada. So welcome today, Don. Thank you.
Thank you very much. My pleasure.
And of course, welcome to all of our guests today on this call. So one of the things that I know about each one of our guests is that there is a personal connection to wandering and Alzheimer's and dementia. Each person's story is a little bit different, but Lili, let's begin with you. If you could give us just a bit of your history on a personal front with this set of diseases.
Yeah, certainly. I developed an interest in Alzheimer's disease and the related dementias actually when I was quite young as an undergraduate student. I didn't have grandparents that lived close to me because we were immigrants. And so coming from a culture that really revered the teachings of older adults in our culture, I started to want to surround myself with older adults. And so I gravitated towards any ability that would allow me to work with seniors. And then this was in the early 80s when, believe it or not, the concept of gerontology actually did not exist. There may have been some geriatricians, but it's really hard to believe now that I have aged enough to actually recognize the momentous growth of this field of care for the elderly or care for older adults. Even physicians were not geared towards working with seniors. All of my peers in school wanted to work in pediatrics. I couldn't really get close enough to older adults, believe it or not. There were no real environment for this kind of learning. So what I found myself in was adult psychiatry. So in acute adult psychiatry was where I actually found the opportunity to work with people living with dementia. Of course, that's changed lots now. I volunteered and was employed as a research assistant at McGill Center for Studies in Aging. Did volunteer work throughout my entire career with local Alzheimer's societies in Montreal, and then eventually in Edmonton, where I started my academic career. And in Edmonton, I started to work with the Alzheimer's Society there, volunteer, as well as eventually then as career partners. Of course, then as I began to age myself, I, of course, then intersected with lots of more than I care to count, individuals who were just phenomenal academics who then developed dementia. And for me, it affected me personally because, knowing about the disease process, being able to try and help people on a volunteer basis, et cetera, was very different than on an emotional level when you have people, how, what a huge impact they made in the academic world. And to see them decline, cognitively, still doesn't, our academic training doesn't prepare us still for that level. So in a way, I see it as more of a sort of impetus or motivation to now train or educate the future generations to continue the work that we've done, we started, and because dementia is not going to decline in terms of prevalence around the world as we age.
That's absolutely correct. And in fact, the latest research from the Alzheimer's Society shows that we're expecting the Alzheimer's and dementia population in this country to double in the next 7 years. That is one of the fastest growing cohorts of people with complex disease out of any disease set that exists. And it has to do with the aging population. So we're grateful, Lili, that you found that vocation. But I know, Karin, you have been touched personally by your experience with Alzheimer's and dementia, not you directly, but someone you know very, very, very well. So if you can spend a little bit of time talking about your experience.
Absolutely. I had the honor and pleasure of growing up with my grandparents, aunts and uncles, and a large extended family. And our family has been impacted by dementia, Alzheimer's in several different ways, both on my mom and my dad's side. I had two aunts on my dad's side that had dementia, Alzheimer's, and ultimately have passed away. And then my grandmother as well, but I got to be a care partner. I like that term you used, for my grandmother when I was in my later teenage years and getting out of high school. So from the time that she started showing signs of dementia, all the way through the whole process of being diagnosed and then into full-blown Alzheimer's, it was about a 16-year period of time. Where I got to take her to her doctor's appointments. I was able to be with her as she progressed through the disease and really learning a lot as a young person, how to care for an elderly loved member, but also or a loved one, but also to understand what that mourning process is like, because death was certainly part of my life growing up. We are a very large family, so it's just kind of a natural progress. But you don't expect to go through that for a significant number of years, and you lose that loved one every day a little bit more. And that was really quite the learning process. So I have a special place in my heart for the elderly community. But it was also really hard to watch other folks that were suffering from Alzheimer's kind of alone when they were in that care facility. So my grandma ended up being a wandering patient, and we had to put her in a home, but we were there every single day as family members to make sure that she was fed and showered and cared for. And so then you start to connect with other people that are in that facility as well, because they don't have family members that can do that or are willing to. And so just kind of adopting others as grandparents and supporting them through this disease and transition in life as well. It's heartbreaking, it's personal for sure, but it was also an honor to be able to care for her in those stages of life.
So thanks for sharing your story, Karin. It is difficult and challenging. It's a heavy lift, and 16 years is an awfully long time, but sounds like you came through it and really have empathy for others who are in this this sort of maelstrom of things that can be unpredictable and challenging. And Dawn, that's certainly been your experience with your mom, hasn't it?
It has, yes. Yes, my mother currently has advanced Alzheimer's. She's currently in a long-term care facility, but this was not her wish. She grew up, or I shouldn't say grew up, after my dad passed away many years ago. She became a strong, independent professional who was very active in her life and really loved her independence and loved her home life with her dogs and her gardening and all of the activities that she cherished. As her family began to notice that she was having significant memory issues, we requested that she go through a geriatric assessment. A full geriatric assessment. It was a week-long process with all sort of relevant professionals involved in that assessment. She agreed to do this reluctantly, and at the end of the process, she participated in the presenting of the findings, which were that it was a recommendation that she go into long-term care, and which she resolutely resisted to do. So she chose to stay at home. She was supported by a pretty extensive network of family, neighbors, and professionals who looked in on her and provided care for her. But despite that, she had at least 3 serious incidents while she was living at home. And despite all of the care that she was getting from an extended network, this did not prevent her from wandering. And so, as I say, there were some serious incidents, one of which, ultimately almost cost her her life, and which, precipitated her, moving into a long-term care facility. And at that point in time, she basically, lost her will to resist, and And so she's, that's where she finds herself today. But that was a long and kind of rocky and painful road. And from a family perspective, some of our worst, nightmares were realized, through this process. So, people who enjoy their independence and value their home life, will resist moving into long-term care, even though it's in their best interests, and in the process they can be disruptive in their own right through their behaviors, including wandering.
So thanks so much, Don. These kinds of stories that you shared, all of you have shared in connection with your personal life, is an interesting bridge to your personal lives. And sadly, these stories are not unique. More often than not, however, we will hear about research to find a cure. And I've had the great privilege of working with some what we call in the healthcare world bench researchers, people who are looking in drug discovery. And there's been some very exciting advances in the course of the last number of years that have occurred here in Canada with some leading experts on the global front. But Lili, you are a bit of a different global leading expert, and your focus of your research is a little bit different than drug discovery. Some of it, like the research we are currently doing together, is focused on patterns of behavior that can be used to help people living with dementia and their care partners now, not 20, 30 years in the future. And much of that research that you're doing to try and avert the crises that happen when people wander. So can you give us it's a lifetime of work that you've done, but in a simple snapshot, Lili, can you give us a little bit more about your research work?
Yeah, I can share with you one project, and I'll talk a little bit about what we're just completing with MedicAlert as a partner. And the one project that's of interest, I think, to the listening audience would be one that is being funded by Public Safety through the Search and Rescue New Initiative Fund, or the acronym we fondly call SARNIF. So there are 4 initiatives very much focused on preventing missing incidents, and also to be as inclusive as possible of Canada's 2 official languages, French and English, and also some Indigenous communities. And so as a result, we've got 6 provinces involved in 2 Indigenous communities. And our research, you are right, Leslie, it's different from other research studies like that look at, which we also do, adoption of technology, reliability, validity, and all of that. It really is about taking best practice evidence and implementing it, and then looking at the impact. So for example, there are 4 initiatives. One's looking at developing a toolkit for communities to all based on enhancing capacity to address the risks of going missing. This is going to take a community effort, not just first responders personnel. Also to develop a guideline for return home discussions that anyone can use. And this is something has not been done. So we did some literature review, found that this is an idea we imported from the UK. This has not been done, and we're moving forward. Just today, we discussed with MedicAlert the possibility of including them in this particular initiative. There's also developing dementia-friendly first responder education tools for our first responders, because you are right, Leslie, the going missing pattern of an individual, the way they walk around who has dementia is very different. And so therefore, the search technique and strategy must be different than searching for, say, a hiker or a child who's gone missing. So we're trying to gather that information. And the 4th is really very much related to what we're working with MedicAlert, and this is on data. Right now, if anybody's looking for data, they go onto the Alzheimer societies, you'll see 3 out of 5 will go missing at one time. We don't even know where that data comes from. It's not useful information. We are getting closer now, even before. So now with this funding, we're working with 9 services, 9 police services or search and rescue services. One of these is actually MedicAlert. And before we actually got this funding, we began, because we identified this as a major issue, a lack of data. So we began this initiative with MedicAlert. We were able to enter into a data sharing agreement. We obtained data from 5.5 years. And now we're actually able, from those subscribers, able to actually describe, we're able to say that most of the missing cases of people who are living with dementia happens during the summer months, like June to August, like as high as 80%. We're able to say that The next highest would be probably during the fall, and then that's followed by the spring and then the winter. We always focus on the winter because, of course, the consequences are that much more dire. When someone goes out in their slippers and no clothing, they inevitably are found severely injured or have passed away, unfortunately. And those are the cases that make the headline. But in fact, these missing cases happen a lot when the weather is nice, you know. So those are the kinds. We also are able, using the MedicAlert data, able to say now with that, those subscribers and the data that we do have, about 23% are repeat incidents. So those are kinds of information we never were able to describe. So we're thankful for that partnership to allow us to do that.
Thanks, Lili. What we've learned and gleaned from the research that is just the tip of the iceberg of what I know will be a long and fruitful partnership, which is one of the reasons why we're looking at raising $500,000 to support the continuance of our research work with you, as well as the development of what that information can translate to from a technological perspective for prevention, intervention, all of those things where we play in the space in terms of keeping people safe. And one of the other really wonderful findings that came out of your research with respect to our subscriber base is when MedicAlert is involved in a missing or wandering person's instance, that people are returned home in 91% of cases unharmed. And there are very few research studies out there that are able to claim and deliver that impact. And certainly it would validate what we have been doing for many, many years, and in our guts know is the impact of MedicAlert. But we're grateful for you and the team at the University of Waterloo for actually validating that information, because it makes it much more real for people who are living that experience. So clearly, technology is a big part of this discussion, and technology has enabled so much more to be designed and developed when it relates to wandering. But there's lots of focus at the individual patient level. But Don, what about the systems we need to support search and rescue? That's what CounterCrisis Tech is currently building with the federal government and other partners in the mix. So tell us a little bit more about your project and how that's going to impact search and rescue across the country.
Okay, thank you very much. Yes, we're also involved in a project that is being funded by Public Safety Canada through the Search and Rescue New Initiatives Fund. This is a 3-year project to address a major technology gap. When it comes to air search and rescue, the military get involved, and they have a standardized platform for conducting air search and rescue. When it comes to maritime search and rescue, the Coast Guard gets involved, and they have a standardized platform for maritime search and rescue. But when it comes to ground search and rescue, because there are so many jurisdictions involved, virtually 10 provinces, 3 territories, and all of the, lower level jurisdictions that encompass those areas, there is no standardized ground search and rescue technology platform to support those organizations that are conducting ground search and rescue. Fortunately, all of these organizations follow a standardized concept of operations referred to as incident command system. So we are adopting that as a framework within our technology solution development, and basically deploying a new ground search and rescue system that supports ground search and rescue organizations. And these are ground search and rescue organizations at all levels of government, as well as 300 volunteer ground search and rescue organizations across Canada. We're developing a new technology platform that supports the way they do business currently, which is very important. This is a Canada-wide program. We have, as part of our integrated team, we have an expert advisory group, which is comprised of ground search and rescue experts from government, as well as from volunteer organizations. And the solution is expected to improve ground search and rescue outcomes, especially by enabling the sharing of data and information related to the persons who are involved in as a lost or missing person in ground search and rescue incidents.
So it's fascinating to me. And Don, I recall when we first met, one of the things that you shared with us and Dr. Stephanie Chan, who heads our programs, innovation, and research department here at MedicAlert, was that ground search and rescue is no longer people lost in the mountains who can't find their way out. In fact, the vast majority of ground search and rescue is related to individuals who wander. That was something that we found to be very fascinating. It's not necessarily always in the area of Alzheimer's and dementia. It could be other mental illnesses or cognitive issues that are part and parcel of that. But nevertheless, it's shifted my own thinking about how we think about ground search and rescue, and what that intersection between public safety and what we do here at MedicAlert, which is hold that healthcare information and that data that can help you to do your job more effectively. In fact, MedicAlert was asked by the RCMP and our friends at the Alzheimer's Society about a decade ago to take over something called the National Wandering Registry. Most people didn't know that it existed. It was actually managed by the RCMP, and it began in about 2005. But what the RCMP quickly realized was that they didn't have the capacity or the understanding or the expertise to manage health data in that mix. They understood the concepts of how that information was used in ground search and rescue, but really the ability to be able to keep health information or wandering information current it's very, very difficult and challenging. And there is no other organization in the country that is equipped to do that other than MedicAlert. We've been around for 60 years. This is our business. We're a charity, so people trust us with that information. So I find this whole conversation really quite fascinating, especially because with MedicAlert, we kind of sit at that intersection between public safety and healthcare. And interesting fact, we've just pulled all of our data for last year with respect to calls and viewings. So we have a call center where people call in an emergency situation where a MedicAlert subscriber is involved. And we also have direct access with our first responder partners through essentially a viewing aspect into our database when they're looking for somebody, to make sure that if that person is a MedicAlert subscriber, they get extra information. It's not just about wandering, because it could be that we have a person who's wandering who might have diabetes and hasn't taken their insulin, which heightens the need to be able to find that person much more quickly before they get into a stage of diabetic acidosis. That's not going to come out today. I'm not even going to say it, but nevertheless, they get in trouble. And that is one of the big challenges in terms of navigating that without that extra health information. Search and rescue folks don't necessarily know or understand, and we can share that information directly. So in fact, last year alone, when we looked at our data, 90%, and this was just overwhelming to me, 90% of the calls to our 24/7 hotline, so the phone aspect of what we do, were for wandering or missing people. So that just tells you the incidence and prevalence of wandering is increasing. So Karin, Rapid SOS is one of the wonderful partners that we are working with in this data exchange in terms of getting information to the front line in a wandering situation. So tell us how Rapid SOS gets information into the hands of first responders before they can even start a search.
Absolutely. So Rapid SOS is an intelligent safety platform that connects life-saving data through tools like MedicAlert into the hands of 911. And we do that through integrations into the equipment that telecommunicators use in the 911 center. And then we also have a product of our own that can sit in that 911 center. The most important part of that is that when we are in contact with a caller in the 911. So I'm a former dispatcher as well. But when we're in contact with a caller, we're typically asking a series of questions. The caller may not really understand what that person might be experiencing at the time. If it's not a care partner, it may be just a witness that comes across a person. The ability to then kind of query that identification number and receive profile information that a care partner has provided really can be critical for that person that they're calling on behalf of. So things as Leslie mentioned, maybe what that diagnosis is, but other medical conditions that also are present. That 911 telecommunicator having that information even before they send responders can help them ensure that the right units are sent, that it's not law enforcement only, but maybe law goes with EMS. And in some cases, fire may need to go with EMS as well. And really wanting to ensure that the right resource is sent at the right time to help that person in need. And then, of course, other pieces of data that could be very important is that emergency contact. Who is that care provider that we need to get back in touch with their loved one? Because also that reunification can sometimes be a challenge when there's not a technological way to receive that. A dispatcher would have to go look in a multitude of databases to try to find that information. So streamlining that call taking process by having this partnership available through the technologies that 911 is using and the ability for them to share that with their field responders can certainly improve outcomes for those that are wandering, also for the callers and the care partners as well that are worried about these folks. So we are excited to announce this partnership that Leslie alluded to a little bit earlier. There will be a pilot project in Ottawa that kicks off in April called Help 911. And this is where we're going to be working with the Ottawa 911 Dispatch Center to ensure that their first responders, which really that telecommunicator is the first responder, and then we have the first field responders as well. But we want to make sure that they have all of that information when a MedicAlert subscriber is involved in a call for service, and have all of that critical health information before the units arrive on scene. I love, Leslie, that you mentioned diabetes as well. That is another thing that has hit my family, and I have been a care partner for both of my parents who were diabetic. Unfortunately, we lost my father a few years ago, but when someone is experiencing a diabetic crisis, it does present in different ways based on highs and lows. That call taker may not necessarily be aware if it's the caller themselves, right? They may sound intoxicated, and that can be confusing. So that information also helps the call taker to kind of change the process and the way in which they ask questions, ensuring that maybe there's a little bit more of an empathetic spin on that call. And I can switch to, because I have information available, maybe different techniques on that call versus trying to identify what the nature of the emergency is. So really, if you think about it, before the last 5 years, these are things that have been so analog by question and answer. And now having the technologies available and that data available to be in the hands of the field responder really is going to make a difference in saving lives. So excited to be partnering with you all as we work in Canada.
That's great, Karin. And yes, Help 911 has been a dream of MedicAlert's actually since we started our Connect Protect program back in 2017. And Ottawa Police Service, who actually are the command central for the 911 dispatch in Ottawa, and our partner there, Rob Bernier, who has been a tireless champion of MedicAlert in the Ottawa community. He came and spoke to our board of directors about, could we do this? I have this vision, I have this dream about connecting MedicAlert right into to what's called the computer-aided dispatch system that we have here in Ottawa. And lo and behold, I had a call from my counterpart at MedicAlert in the US saying, hey, we've got this really great partner in Rapid SOS. Maybe you might be interested, because I know this has been a dream of yours to create this technological bridge that, for all intent and purposes, not that we would ever do away with the physical ID, because there's still some really important things around the analog nature of that ID, particularly with Good Samaritans who recognize and understand our logo. But nevertheless, when it comes to technology and getting information in the hands of first responders before they arrive on scene. You described it perfectly, Karin. It will shift the way the dynamic of the dialogue happens. And Lili, this sort of speaks to what you said earlier, which is part of the bigger research project that you are undertaking, which is how do we help the first response community respond effectively and appropriately to incidents of wandering, and how much information can help in changing the dynamic of that particular response. And our Help 911 project in Ottawa, so Ottawa, wait, we're coming, is that what we hope to be significantly game-changing. And this is something we couldn't have done 5 years ago. We couldn't have even, we imagined it 5 years ago, but could we have done it 5 years ago? Certainly not without our change in our technological backbone. So Lili, tell us a little bit more about where you think technology is going to take us in the next 5, 10 years that will help individuals living with dementia.
Course. Now, I think it's important to think about this in the context of the bigger scheme. And so this is really, really exciting to hear about this initiative, Karin and Leslie. So congratulations on this. I look forward to hearing more about it. There is so much technology out there that is coming together now. And by that, what I mean is that soon we're going to, even now, actually, we're going to see individuals not having to carry around, as you mentioned, maybe wear a bracelet or carry around multiple devices for multiple purposes that, in fact, they can be monitored sort of ubiquitously through the cloud or through various other, data-driven types of technologies that are affordable. I think one thing to keep in mind is that this service that we're describing is really still a subset of the population that has access to. So more and more now we need to consider those who don't have access to this, those who don't subscribe, those in rural areas. So there are multiple ways you could address this. One is we find a way to get everybody to subscribe, and we address the cost through, a national or a provincial kind of an initiative. Or, and I don't know that that's realistic, or we use a multi-pronged approach for the rest of the population that don't subscribe or don't know, haven't got a diagnosis, but still go missing, that sort of thing. And someone mentioned Good Samaritan. There are technologies out there that can be community driven. And a good example of an alert system is in Scotland. They have the Purple Alert, which is managed and hosted by the Alzheimer Scotland. We have such a technology very similar that we've developed in Canada, but because of our privacy legislation at the provincial and federal level, we're unable to have Good Samaritans and families trigger those alerts. It has to go through the police, which now is just adds to another tool that the police can use in terms of social media for alerting the public, but it doesn't make it any faster to identify and locate somebody that, to the extent that your system is trying to do, is trying to streamline. So I think we do have the legislations that we have to deal with that other countries don't, and so that needs to be worked out. But I do think that that is something that we really need to, on a policy level, need to address, and not just look at innovations and where technologies can take us. And then the other thing to keep in mind is, and I'm sure we'll get to a little bit later, is sometimes we don't use technology. We really have to listen to the end user, the individuals who are living with dementia. Although I think more and more now, as we all age, we are going to be much more comfortable. But there's still segments of the population, including those that are young, who don't want to use technology for fear of, privacy reasons and that sort of thing.
So you're absolutely right, Lili. And privacy legislation is something that we spend a lot of time looking at here at MedicAlert, because we are a national service. And one of the more interesting things with respect to use of data and restriction around use of data is that for now, and I will stand up with you, Lili, and everybody else when we're talking about legislation like PHIPAA, which is the health legislation that locks essentially hospitals and clinics and your traditional service providers into restrictive ways of sharing or not sharing information, which we have over time really discovered hinders our healthcare system and the ability to be able to look at populations on the whole. MedicAlert is not hindered by that, and some of that data set that we have is helping to drive some better insight and knowledge and understanding. But Karin, as we look to the future and managing wandering instances, other than legislation, there's got to be other barriers that we are trying to break down. And I know that's certainly something that when Rapid SOS sort of came to be, you must have had these kinds of conversations in terms of what your technology might be limited by. So talk a little bit about that and how you might have been able to overcome those barriers, or what might still be there.
You know, you've both alluded to, I think one of the biggest things is the concern of privacy and security of my data, because at the end of the day, that is my personal information. And so we have worked very hard to ensure and to also build trust around when that data can be accessed. And that is only during an emergency call, during a 911, and very few minutes afterwards. Data is not stored. We cannot store it. So after a period of time, it goes away. We do not have access to it. So the telecommunicator won't have access to it. It's not an investigative tool. And so really ensuring that folks understand the when we can receive this information, when it can be accessed, and really educating the public safety community on what tools that they do have access to. So education is really, really critical here. And then, of course, you've mentioned as well, not everyone wants a technological solution to their condition. So they may not want to be monitored 24/7. So having data that sits, either on a medical ID that's worn on a person or on some sort of a card, you have a QR code on yours that can be scanned, to really ensure that when a person does wander, because I don't think it's an if situation, it's a when that person does wander, whomever they come in contact with, and hopefully it is that Good Samaritan or somebody that comes in contact, because you certainly don't want to find them when it's too late, can receive that information, can relay that information to public safety through the technologies that we do have access to, so that we can improve that response. So I think a lot of it can boil down to that education and ensuring that folks understand and are aware of the securities that are involved, the encryption and all of those different things, to trust that the technology is only going to be used when an emergency does occur. And at the end of the day, when you do dial those 3 numbers, 911, you want to make sure that they have the best information possible. And so when we educate our community members, as well as our field responders and our public safety ecosystem, and really truly understand that we're working together in this mission, that's how we can overcome some of these barriers and these objections. We are all in the same mission, and that is to save someone's life.
You said it beautifully, Karin, and it really is about navigating and managing and being responsible for people's information and their data. That is something that we know you as our partner take seriously. It was one of the things that we spent a lot of time talking about with you in terms of making sure that we ensured the data that we are able to move through your pipeline. I always think about it like a pipeline to the 911 center without it hanging around in that pipeline, residually or otherwise, but only being used in that instance where somebody is having a medical emergency and needs that help, and that information is vital in order to be able to make sure that the outcome is improved over what would happen potentially if that information wasn't there. So that's challenging. And when it comes down to building these systems that are designed to keep people safe and bring them home as quickly as we can when they do go wandering, is really all about the data. And while there's lots of discussion around privacy, I remember I've been in healthcare for a really, really long time, and that discussion always goes back and forth about sharing of information and what levels of privacy. And we did research about 3 or 4 years ago, a national poll. And when we asked that question, when it comes to first response, 91% of Canadians over the age of 18 say they want first responders to have that information. It may be different in a clinical situation where you're in diagnostics or those kinds of things where it's still emergent or but in an urgent situation, please give the information. That's why what we have in our environment is something called considered consent. But Don, from your perspective, what happens to that discussion about data when people are missing in a bigger situation? I think about the flooding in Manitoba that happens, or we had the hurricane on the East Coast not too long ago that really showed the impact of what search and rescue truly means and how things can really explode. And there's got to be some practicality around being able to access necessary information to organize a mass search for people. I always think about it like if there were 1 million people impacted, would the search and rescue crews not want to know who's on oxygen? Who might be better served by search and rescue crews getting to them first versus those you happen to come across in the midst of all of these kinds of things. And I'm not doing service to anything that ground search and rescue folks do, but that crosses my mind, especially when you're looking not for one person, but you might be looking for 300-400 people. And in among that population, you might have 10, 12, 15, 20 individuals who have dementia who are not necessarily aware of what's happening in their environment. So Don, talk about that practicality of getting information.
Well, I mean, it's of utmost importance, and of course, provision of data to emergency management and search and rescue organizations is all predicated on authorization of the data to to appropriate organizations. But given that the provision of data has been authorized, it's everything to a search. Ground search and rescue is fundamentally the foundation of emergency management. We can say as human beings, we've been doing search and rescue for 100,000 years. Somebody from our tribe goes missing, the first thing we think of doing is sending out a party to go look for them, right? So we've been doing this forever and a day. And the problem is complicated immeasurably by the magnitude of the incident, right? And all we have to do is look to the recent earthquakes in Turkey and Syria to see what that magnitude might look like. 50,000 people, lost their 50,000 people or more lost their lives. How many people were impacted? In the millions, right? And that gets into a level of organization that involves registration and inquiry and tracking of missing people on a huge scale, right? So those kinds of systems that are used in incidents of that magnitude are integrated systems that are pulling data from a variety of sources. You're pulling data from real-time information sources. These could be drones or satellites or human elements operating in the field. Also, you have organizations that are trying to organize themselves within a framework that allows them to share that information in a timely manner in order to make critical decisions. And it all boils down to prioritizing decisions. And if you were to boil down, a large-scale emergency to the initial steps that you would take, it's the search and rescue aspect of that, the immediate location and rescue of individuals. And the more information that can be provided on individuals who are missing, the better. And in fact, really what's needed is a complete profile of information, including health information on individuals. And that type of information allows first responder organizations and organizations who are charged with being in command of large multi-jurisdictional, multi-agency type of incidents to to basically be able to prioritize the urgency related to the search and rescue of, down to the individual level. And that involves as much information as can be provided, and it enables the organization to develop the appropriate initiation and management of the incident in order to bring a successful conclusion. So yes, of course.
There's just so much potential here, Don. Absolutely.
Yeah.
We're getting close to the top of the hour. An hour is not nearly long enough to talk about this subject. We've just really scratched the surface. And so if I could go around the table here and ask you, and it's not an easy task that I'm about to ask you, is to sum up the importance of working with MedicAlert when it comes to management of individuals who wander. Karin, I'd like to start with you. In one sentence or less, what's the most important thing from your perspective?
Create your profile, ensure that your loved one has that information that is available so that the telecommunicators and the field responders can access that data when an emergency occurs.
Wonderful, thank you. Don, from your perspective.
I agree exactly with what Karin just said. It's that detailed profile and any kind of related information in terms of health. I'm looking at a list of investigative questions right now that incident commanders would ask in the event of a lost or missing person with dementia. It's a very long list. So that complete profile is key.
Wonderful. And Lili, last word goes to you.
Okay, I would say that MedicAlert and the good work that you all do is just one component of search and rescue or identifying someone who goes missing and trying to bring them back home safely. There's so many other things that we can do with regard to our assumptions, the stigma, internalized stigma, all of these, the myths around going missing, for example. It doesn't just happen in new environments. It also happens in continuing care centers. Just because you think it's safer to put someone in a home, it doesn't mean there's, so the kind of work that you're doing needs to cross all of these intersections, not just focus on, the home or the community environment. And that technology can fail us, so that we need to also think about a multi-pronged approach to addressing this issue. And finally, I would just say that, and this is all one string, non-long sentence, is that despite all of our efforts to prevent a missing incident, a person can still go missing and unfortunately can also be found not alive. And so we have to ensure that the care partners do not feel guilty about that, and that sometimes we emphasize prevention so much that we forget that it can still happen, and it's not their fault.
We couldn't agree more, Lili. We do talk about prevention quite a bit. We are working with each one of our partners here on this call to figure out other ways, multiple tools to be able to help support care partners in the management of this devastating set of diseases that have significant challenges for so many families, but there is no reason for any care partner to feel guilty. You're not in control of this disease. The disease is in control of the person, and we're here as partners in supporting you. MedicAlert, you're right, Lili, is one aspect of being able to help support. And if we can work upstream in the prevention realm and downstream, catching people in the search and rescue process with our information that helps to be able to return people home safely, which we have proven in the research that we've done with the University of Waterloo does work. 90% of people return home safely. We'd like to increase that number to far higher than that. But it takes time, it takes investment. It's one of the reasons why we're raising funds as an organization to help the continued support of building tools, continuing our research, and doing everything that we can to build a safety net around this population that isn't just the population itself, it's the broader individual set of care partners and others who care for individuals living with dementia. So thank you To everybody who's joined us today, I'd like to thank my fellow panelists here, Dr. Lili Liu, Don Williams, and Karin Marquez from Rapid SOS. This is just the beginning of this conversation. There'll be so many more to come. So watch for more information coming from our panelists. They've all agreed to continue to answer questions that come in after this. So we'll be seeking that and seeking your input as we continue to grow and develop our Safe and Sound program. Thank you so much. I'm Leslie McGill from MedicAlert. We thank you for joining us today. Take care and stay safe.